Welcome back to Upper Michigan Today, everybody. We are highlighting American Heart Month. And in that commercial break, about 6 Americans died from heart disease. It is the leading cause of death for people here in the United States. So today's show is talking all about lowering your risk and knowing the signs and symptoms of cardiac arrest. Plus, knowing how to do hands-only CPR that could save your life or someone else's life potentially. We're joined now by Joe Ackerman and Curt LeSage of UPHS Marquette to really dive into this topic of heart health, a super important topic because it really kills a lot of people. It's a really tough pill to swallow, but that's the truth that we're dealing with here in the United States.
Yeah, I mean, it's like you were saying in that little 10-second blurb, I always go with the hour of your show, so I'm like 120 people have heart attacks.
It's almost hard to fathom that.
Yeah.
Right, and it just happens so often that I don't know if we just get immune to, it just happens and that's fine. So if it happens to me, I'll be okay and everything else, but it does make an impact. It does make an impact over and over and over again, and there is nobody that is like immune to it either.
Yeah.
So we've had, and Curt can attest to this too, we've had people that come in 20 years old that have chest pain. And I'm like, all right, chest pain at 20 years old, that just doesn't register in your brain, but they are susceptible to that. Now there's a lot of things that have to fall into there, like their background, their family history and things like that, and how they take care of themselves. But majority of those people are kind of one-offs.
Sure.
But then now you get into, like we were talking about, women, 34 and up, they're more susceptible to heart attacks and everything. When you're thinking that 34, that's kind of young.
It's real young.
You know, because in my age, I'm almost 60, and you look at it and like, okay, now I got to start worrying about it.
Yeah.
But no, I should have been worrying about it almost
when
30
you were 20,
right.
30 years
absolutely.
ago.
So what actually happens when someone has a heart attack? What's going on in the heart?
So a couple different things are happening. So your heart works on an electrical system, and then it also works on a physical pumping system, right? So when you have a heart attack, what's happening is that the pump part of it is basically getting stopped through a blockage, through a partial blockage or something else. So that part of the heart is not getting the oxygen that it would need to function. And so it's basically a muscle. It's a big muscle like this, all right? So it's a big muscle. It needs this stuff to keep going, just like any other muscle in your body. And if you cut off that supply, then guess what? It starts to die. And it's that function, or that process of it dying, is what you're feeling in chest pain and everything else. So.
Sure.
Curt, as an EMT, how often are you responding to heart-related emergency calls or cardiovascular disease?
In our coverage area, we probably average 30 or 40 calls a month, every month, with something cardiovascular related, chest pain, shortness of breath, a lot of those, so it's prevalent here in our community. It's important, I always tell people when I talk about chest pain, is those signs and symptoms, recognizing that those signs and symptoms are happening to you, because the best thing you can do to help yourself is recognizing those signs and symptoms and realize it's happening to you, admit it's happening to you, and go in early. Time's really one of the best things you can do as a patient, that you're able to help yourself and help those physicians and the emergency departments, the cath lab, help those be able to treat those issues, is giving them the time to be able to do it. So recognize it and getting in.
Right, and we'll be going through those signs and symptoms later on in the show, but really 30 seconds sounds like it could be the difference of life or death even.
Greatest risk for death occurs in the first 2 hours of the onset of those symptoms.
So how do you take those signs and symptoms and acknowledge them properly, right? Because I think sometimes we think, oh, it's nothing. Oh, it's my anxiety. Oh, I'm just not feeling well today. It's so easy to disregard them. So what is your advice for knowing what is real and what is not?
Right, so let's go to chest pain. We'll just use chest pain as the general. So if I'm having what I consider chest pain, so middle of my chest, it hurts, and I'm like, okay, all right, it's not going away. It's getting more intense, and it's lasting longer and longer and longer. all right? At that point in time, you better start thinking about doing something right then and there, all right? So if it's a hit and miss, if you're out cutting wood or whatever, and you come in and it's the first time you've chopped wood in 6 months or whatever, that might be more muscle related, and it might go away, all right? So it's the fact that it's not going away.
It stays persistent.
It stays persistent, and it's going to get more intense and longer in duration too. So
Sure.
So it's really important to pay attention to the consistency of the feelings that you're feeling, and knowing how your body is changing through time. We've mentioned a couple of facts about heart-related disease, but I want to get them up onto the screen so that you can take a look too. So a death occurs here in the United States every 33 to 34 seconds. That really seems kind of like an alarming
so
statistic.
alarming.
Right.
That's 2,500 deaths each day. And then you say it's the leading cause of death as well, even more than cancer and accidental death.
Yeah, I mean, if you take all the people that die of cancer and all the people that die of traumatic, you're still not to the point of people that die of heart disease.
Yeah.
All right. So, but you also have to remember that heart disease covers a lot of different things. All right. It's not just having a heart attack. It's not just that.
Sure.
You have valve problems. You have other problems that kind of umbrella under this big topic of heart disease.
Okay.
So it does cover a lot, but it is all heart related.
Yeah,
It all comes back to the heart. So you have to be able to understand that I'm not immune to this. All right. So if I recognize that I'm at risk, all right, through whatever means, then I have to be aware of if things are happening to me, signs and symptoms and whatever. All right, I might not be able to just push them aside.
Yeah.
I'm going to have to actually do something about them.
Well, this is such an important show. It's such an important topic. February being Heart Health Month is such a great reminder to take all of this seriously, to pay attention to our bodies. We're going to continue to talk through this, specifically talking a little bit more about women and what that means for us. We're going to take a break, but we'll get into that when we come back.